A healthy immune system helps our body to fight off infections and disease, such as cancer, by making protective antibodies that attack these foreign invaders in the body. Sometimes the immune system doesn't work properly, and instead of attacking foreign invaders, it attacks our own tissues. This is referred to as an autoimmune disorder. SLE is a chronic autoimmune disease characterized by the formation of autoantibodies that attack the body's own tissue, causing damage to various organs and tissues. SLE can affect tissue anywhere in the body, but it mainly affects the joints, kidneys, and skin. The disease can affect all ages, but it is more common in people between 20 and 45 years of age. It occurs 10 times more often in women than men, and is also more common in people of African and Asian descent. Causes. The precise reason why the immune system misfires is not clear, but genes seem to play an important role in determining susceptibility to the disease. Thus, the presence of autoimmune disease such as lupus, rheumatoid arthritis, diabetes, or autoimmune thyroid disorders in the family history increases the risk of developing SLE. Often, an environmental factor such as infection, exposure to sunlight, or drug allergies acts as a trigger, and the body starts producing autoantibodies against its own tissue. These antibodies are mostly anti-nuclear antibodies, ANA, that react with the body's own DNA, leading to the formation of immune complexes that deposit on blood vessel walls, in joints, and internal organs like kidneys, stimulating a severe inflammatory reaction that damages the tissue. Symptoms and diagnosis. The symptoms of SLE depend on the body part affected. General symptoms may include fever, fatigue, weight loss, blood clots, hair loss in spots or around the hairline, heartburn, stomach pain, and poor circulation to the fingers or toes. Pregnant women may even have a miscarriage. The symptoms vary from person to person and may also come and go suddenly. This makes the diagnosis of SLE difficult. The rheumatologist will perform a physical examination and will listen for an abnormal heart sound called a heart or pleural friction rub with a stethoscope. A nervous system examination will also be done. The rheumatologist will also look for typical signs of the disease that include rashes. The rash may occur as a simple rash on skin exposed to the sun, a round or disc-shaped red raised rash with scales, discoid rash, or butterfly-shaped rash over the cheeks, malar rash. Mouth sores. The sores may be present in the mouth or nose and may last a few days to more than a month. Arthritis. Swelling and tenderness may occur in 2 or more joints and may last for a few weeks. Lung inflammation, pleuritis, or heart inflammation, pericarditis. These may cause chest pain when taking a deep breath. Poor kidney function. This may be reflected in the presence of blood or protein in the urine. Neurologic problems such as seizures, strokes, or psychosis. If the rheumatologist finds at least 4 of these problems present and cannot find a valid reason for them, the rheumatologist may suspect SLE. To confirm the suspicion, the rheumatologist may order a series of blood screening tests. Anti-nuclear antibody ANA test is the most important test among these. However, a positive ANA does not necessarily indicate SLE. Therefore, more specific tests such as anti-double-strand DNA, anti-Smith, or anti-phospholipid antibodies may also be ordered. Complement proteins may also be measured to detect or check the progression of the disease. Treatment. There is no cure for SLE. Treatment is aimed at managing the symptoms and providing the best quality of life for the patient. Patients with mild SLE are treated conservatively with nonsteroidal anti-inflammatory drugs and anti-malarial drugs. Corticosteroid creams may be prescribed to treat skin rashes. For patients with serious, life-threatening symptoms indicating central nervous system, heart, lung, or kidney involvement, aggressive treatment is given with high-dose corticosteroids and immune suppressants. If the symptoms do not improve or get worse, cytotoxic drugs may be prescribed. Conclusion. SLE is a very complex disease. It has many symptoms and is difficult to diagnose. There is no cure for SLE, but with improvements in treatment, most people with SLE can live active, normal lives. Since SLE can flare up or go into remission suddenly, frequent health checkups are essential to track the symptoms and change the treatment as needed.